If we've learned nothing else as a country during the course of this pandemic, it is really that everyone needs help sometimes, um, and that that help is not always as available as it should be. It's always not accessible, um, and that we should truly work to recognize that seeking help is a sign of strength. And disasters, whether they are public health or natural, um, show us what's possible when communities come together and rally around families. And it really shouldn't take disasters or public health emergencies to remind us of this.
What we're talking about. We're talking about the essential role of primary prevention, but it's also the essential role we all play together across sector, across discipline, across organizations. I'm so thankful for the opportunity to be with you all today, from Children's Wisconsin, from the Child Abuse and Neglect Prevention Board, from PCA Wisconsin. Your parenting, which we know is challenging anytime, all year round, but parenting during a global pandemic, during a moment of acute racial and civil unrest, during a very polarized time in our country, in our history. Natural disasters abound, hurricanes in November, wildfires across the country. What I hope one silver lining is that we're all able to see public health in action, right? Sometimes it's so abstract. What do we mean by public health? What do we mean by preventing something before it occurs? We mean this definition. Public health is what we as a society do collectively, not one silo at a time, one agency at a time, collectively, to assure the conditions in which all people can be healthy. All people. ACEs are common, no matter how you measure ACEs. You have, about 61% of people that at least experience one ACE, and that's just the ones that we measure, right? And when we add, the COVID ACEs or other experiences that are not captured in the traditional measure, we know that ACEs are common. But I just call you to the bottom two layers of this pyramid, because many of you have seen this pyramid over the years, and it used to end, the bottom layer was ACEs, as if ACEs just come to be, like they just appear and they're inevitable. And of course, we know, and all of you know, that is not true. We can prevent early adversity, but we have to back up and we have to see the historical traumas, the social conditions, just everything that came before. So again, those roots of the tree that give rise to the experiences, the likelihood of the experiences. So essentials for childhood: assuring safe, stable, nurturing relationships and environments for all children. This is CDC's vision for this work. And certainly it's a mouthful, but all of these words critically important. I mean, CDC, the leading public health organization for our country. So assuring, good. That's a very leadership role. They need to take a leadership role in safe, stable, nurturing relationships. Of course, those mean safe, stable, nurturing relationships between parents and their children, but it also means safe, stable, nurturing relationship between children and other adults in their community, like teachers or coaches or mentors, right? That can sometimes buffer for the lack of safe, stable, nurturing relationships in the home. Also, those kinds of relationships between parents and other adults, that we have multi-generational data that shows that parents that have those kinds of safe, stable, nurturing relationships with other adults in their community have kids that do not experience child abuse and neglect at the same rates. Okay, so this is an important and strategic part of this vision. We also want safe, stable, nurturing environments for all children. And of course, that means the physical environment, home environment, school, community. But it also increasingly means the broader socio-political environment. We know that there are some contexts and conditions that support children to achieve their maximum health and life potential, and others that frankly just don't meet the mark. And we need this for all children. Because we're talking about assuring the conditions, then that means getting to those policies and systems that have been founded on systemic and institutional racism and other systems of oppression. This is not just another part of our work. This is our work, right? To really make sure that we are working together to protect children from the effects of systemic racism. And there's no comments I could give without saying that prevention can only happen in partnership. This is not the work of one organization, one discipline, one sector, but what we can all do together across sectors, and challenging us to bring in newer partners into this work, right? Chambers of commerce, media, people that don't really see themselves as like child and family people, but really understanding that we all have a role to play in keeping families and communities strong and thriving.